Hello, this is Dr. Manali with Legacy Physical Therapy, and today I wanted to talk to you guys about dry needling in the pelvic floor. Dry needling might be something that you have heard in passing on social media or know have friends that have done it. It's something that I would say is a little newer um, as far as treatment techniques go in the physical therapy world, but we've found it to be very safe and effective. So I wanted to answer some maybe hot button questions that you might have regarding dry needling and tell you guys a little bit more about it. So let's get started. Dry needling is considered safe and effective treatment techniques that we use. Three main kind of purposes and goals that we have for it is going to be reducing pain, reducing any inflammation that you might have, and promoting healing. The process involves a thin needle that is inserted. It penetrates the skin and tissue and it targets specific muscle points that we call tension or trigger points. Tension or trigger points are basically any points that they can feel like knots. It can be tender to the touch. And those are the points that we tend to needle to get the most effective relief. Dry needling can be really effective for the pelvic floor and the areas surrounding the pelvis. Muscle tension in areas throughout the front of the hips, back of the hips, throughout the low back, those tend to also play into a lot of tension in the pelvic floor. And so if we're able to get in and needle those spots, sometimes we can provide a lot of good relief of the pelvic floor itself. We are also all trained in dry needling of the pelvic floor itself. So if there are specific spots that we feel you could benefit from needling of that, we are also trained in that. There are a couple of contraindications or patients that we do not dry needle. So dry needling, it would be appropriate for most patients. However, if you are currently pregnant, we do not dry needle any pregnant patients here at Legacy. Also, if you are on any blood thinners, we do need to know what those are and a little bit more medical information on you regarding that to determine if you would be appropriate for dry needling or not. Also, if you are currently recently had any surgical history or are recently cancer free, undergoing chemo or radiation, those are some things that we really need to dive into as far as your medical history goes to see if you'd be appropriate for dry needling or not. However, overall, dry needling is appropriate for the vast majority of people, and so this is something that we have a screening tool to really go through and talk to you guys about what it is and the contraindications or relative contraindications to see if you're appropriate or not. But that's something that if you are considering this treatment, we will go through that with you. One of the other questions that we get commonly asked is dry needling like acupuncture? And that's a very good question because we do use the same needle types as acupuncturists do. However, we have a very different purpose to them, to the technique. So dry needling, someone who is dry needle certified is something that physical therapists go through additional training to become dry needle certified. Acupuncturists go through their own training to become an acupuncturist. Acupuncture basically is more based on the Chinese medicine philosophy, and they go through more of they will possibly needle areas that will make the chi or energy chi flow throughout the body to treat a variety of muscular or even non-muscular conditions, versus physical therapists are more looking at needling these tension or trigger points to really be effective. Dry needling is only as effective as we only effective if we really bring in a lot of other techniques that we already use, maybe different manual techniques that we can use or exercises that will just be used in conjunction with that dry needling. So if you are interested in trying dry needling or considering it, go ahead and give us a call. We will go through this in a little bit more detail to talk about how it can specifically help you and your symptoms. And we'll go through that screening tool as well to make sure that you are fully appropriate for it. So yeah, give us a shout. Have a good day.